Hi, I'm Jenn Coffey. I'm a volunteer member leader with Rights and Democracy, New Hampshire. When I was a Republican state representative and vice chair of Commerce and Consumer Affairs, I knew that some healthcare mandates were needed, but I believed that insurance companies would cover the basics. I learned the hard way how very wrong I was when it became me in the medical bed. For 20 years of my life, I served my community as a nursing assistant, cardiology tech, emergency department trauma tech, and an EMT answering 911 calls. I walked into Dana-Farber Hospital a fully functioning person and was wheeled out broken and unable to do the work that gave me purpose. Breast cancer ended my career. The surgeries and medications caused irreparable damage. I suffer from the most painful disease known to modern medicine, CRPS, complex regional pain syndrome, the suicide disease. 70% of people with it, young and old, will consider suicide, and it shouldn't be that way when treatments are available, but insurance companies refuse to cover them. The severe small fiber neuropathy that came with the CRPS has destroyed so many of my nerves that I'm not supposed to be able to stand here with you today. When I was diagnosed, I had United Healthcare Medicare Advantage, a privatized Medicare plan. They refused to pay for the care that I needed to stay alive. I had to sell everything I owned, even my car, to afford the infusions I needed to live. While I was doing that, United Healthcare shareholders were making more money by denying medical care to millions. While I lost what was left of my dignity, they bought more yachts, private jets. They don't fly with the peasants. Thousands in New Hampshire have lost their health care. My own loved ones lost it when Republicans refused to extend the ACA premium tax credits. Their rich buddies get tax cuts. Working families get tax increases. I begged United Healthcare. I went to Washington, D.C. when the United Health Group CEO, Sir Andrew Whitty, was testifying in front of Congress. I asked him to listen to us, his members, to help us. He turned his back and he walked away. He walked away from a 25-year-old given 5 years to live without a surgery that United Healthcare refused to cover. Some in New Hampshire now have a new income tax to pay if they need Medicaid. The poorest among us just got the first income-based tax in our state's history. There are no breaks for those who are forever sick. Moms and dads caring for their severely disabled children at home now, not only do they have to reapply every 6 months, but they face their children being ripped from them and institutionalized, while Congress is poised to steal even more for their never-ending wars. 75% of New Hampshire recipients work. A cancer patient shared in the union leader that she was already working 40 hours a month around her chemo treatments. The new requirement of at least 80 hours will kill her. 1 in 10 veterans in New Hampshire have Medicaid. 1 in 4 children as well. People are already suffering and dying from the draconian cuts that have been made. Now they want more, to fund war, to fund a ballroom, while Americans are starving in the streets and more people become homeless. People can't afford to eat. Their grocery bills have doubled. Gas is so insanely expensive that folks are delaying medical treatment. They can't afford to put the gas in their cars to get there. None of this will end if we don't cut off the grotesque stream of money being shelled out in our names. They are proposing another $1.5 trillion more to fund war after they told us there's no money for health care. And they have already made so many cuts to Medicare, Medicaid, food, housing programs. Some hospitals have shut down and others will shut down because of the cuts they already made to Medicaid. They said they came to drain the swamp. Instead, they've drained healthcare, food, and basic American values. They may not be shooting the sick and disabled in the streets, but they are getting the same results. Fund healthcare, not war.